Today I'll be addressing the concern from a young lady who is suffering from polycystic ovary syndrome. Today in the United States, nearly 10% of women are suffering with PCOS, polycystic ovary syndrome. And this challenge causes menstrual difficulties, extreme pain during the menstrual period, sometimes lack of periods. And the challenge here also is that the woman that wants to have a baby is going to suffer from extreme challenges with conception. And so today here, I'm going to address some of the symptoms that you ladies will want to take into account if you feel that maybe this could be the challenge that you're having issues with. I'll also address here what the main causes are of PCOS. And so let's begin. First of all, these cysts are sacs that are non-malignant. They're chambered sacs that tend to form on the ovaries, and they tend to be fluid filled. If you are suspecting that you might have ovarian cysts, I have my list here of specific symptoms that you may want to take into account. Write down if you are suspecting that this could be the challenge. We've already seen today, ladies, that with surgery, surgical removal of the cysts, this does not prevent challenges of ovarian cancer in the future. What you should consider, and what I've done with my patients, and what I have addressed also in my book, The Naturopathic Approach to Fertility, when I was asked to write this, I did address in the sections regarding female sexual health what I have done with my female patients to help shrink the ovarian cyst, draw out infection, and bring down the inflammation also to help them conceive. And so let's address all of that now. If you feel that you may have the following symptoms, you might have ovarian cysts, consider the following. If you have acute or chronic pain or swelling in the fallopian tubes or the ovaries, and also have been trying to conceive for at least a year without any hope, and you've seen that you have not become pregnant, then consider that you may be having a challenge with ovarian cysts. Now, know that also most sufferers of ovarian cysts tend to have hypothyroidism, low thyroid challenges. And so you'll want to feed the body natural therapies that are going to help to increase iodine levels to help correct the challenge of the low thyroid. Most of them also develop weight gain from the hypothyroidism. And things that go along with PCOS are challenges such as insulin resistance. You have an excess of estrogen. I'll detail exactly more of those causes. But these are some of the challenges that a woman is going to have issues with, uh, including accompanied by obesity, many times also eating disorders. I've noticed in some of my patients that have come to me in these close to 30 years of practice tend to have these issues because they're seeing themselves with this hormonal imbalance that has caused them to now have all of this excess weight gain. And then eating disorders tend to come about from them seeing themselves suffering from these challenges. So it's a whole array of sad issues that a woman is suffering from when she's dealing with this health problem. Unusual abdominal gas and fevers and a coated tongue are very specific symptoms of ovarian cyst present. All these down, ladies, so that you can share this with other women. So you can share this if you are a mother with your daughters, if you see your daughters suffering with these challenges. Some women also tend to experience excessive hair growth, excessive facial hair growth as well, because there tends to be a severe imbalance of their estrogen, progesterone, and testosterone. So that's something very indicative also of PCOS challenges. Profuse uterine bleeding, as I mentioned a moment ago, and wearing tampons just makes things worse, ladies. You are maintaining toxic blood within the body by utilizing tampons, and so you most definitely want to switch to non-chlorine maxi pads if you are having these challenges. When I'm working with my female patients, that's one of those first things as far as lifestyle habits that I incorporate that they are going to have to change when they are having these sorts of challenges, so we can shrink them successfully to help them conceive if that is the desire of the woman to have a baby and she's having challenges with fertility. Now, know that endometrial hyperplasia of the excessive uterine bleeding is most definitely caused by unbalanced estrogen levels. And we're talking about xenoestrogens, foreign estrogens, spelled XENO estrogens. I also tell my patients to refrain from drinking from styrofoam cups, eating on uh, styrofoam plates and such, to also limit as much as possible constant exposure to, for example, laptop screens and the foods, the hormone laden meats and such that are just feeding the excess estrogen problems that they are suffering. All of this is an issue. And so we have to make some lifestyle changes so that we can shrink those cysts. Erratic menstrual cycles with unfamiliar pain. Specifically, ladies, you'll notice that it's almost one-sided, kind of right there on either on the right or the left or both sides if she's having severe issues. And usually it switches month to month. But that discomfort in that lower abdomen region, a lot of swelling and inflammation. You'll notice every time that her period comes about, those are some of those symptoms that you'll want to look into if you are suspecting that you are having ovarian cysts. So let's talk about the causes of ovarian cysts, ladies. Too much estrogen is one of the most common causes of ovarian cysts, an estrogen dominance challenge. And so we need to balance hormones. When this is corrected, when the woman is now having a true balance of estrogen, progesterone, and testosterone level, then naturally these fluid-filled sacs that are bombarding her ovaries shrink. The inflammation comes down. The ovaries start to produce eggs. She starts to ovulate naturally, and then she is able to conceive. Some research has pointed to the fact that birth control pills are a huge also contributor, ladies, to the issue of PCOS, ovarian cysts. Synthetic hormone replacement plays a huge part in this sort of a challenge. Lifestyle habits, and I cannot say this enough, like too much caffeine will contribute to ovarian cysts. It's as if I have a battle sometimes with my female patients when I suggest that they eliminate coffee, the hydrocarbons, that chemical processing of the coffee is truly what causes and feeds a lot of these sorts of challenges. And so, ladies, do that. In my book, I also share how caffeine is a huge contributor to causing you to be twice as likely to suffer from delayed conception. And so, if your desire is to have a baby, to start a family, to be able to have that precious baby in your arms in the next year, then it's time to make those lifestyle changes. Too much caffeine is a contributor to ovarian cysts. A high fat diet is also very much involved in these challenges. And so consider, ladies, reducing the fried foods, reducing the high amounts of animal meats that you are eating. I cannot help you shrink these cysts to help you with conception if you are still eating in that same manner. Now, as I said, most sufferers of PCOS tend to have weight challenges. They tend to be overweight. And when we bring in these changes, these natural therapies, these lifestyle changes, and also diet changes, these cysts shrink. The ovaries start to help produce eggs, they start to ovulate, and of course, viable eggs is what you want your ovaries to start producing, and so then you are able to conceive easily and happily. Using or having formally used an IUD also, we have seen in research, is a contributor to the development of ovarian cyst PCOS. We also want to take account that diabetes sufferers, especially those that intake alcohol. The liver, ladies, is the filter of fat, the filter of blood, and the filter of hormones. If you are overloading it with alcohol, then the liver cannot filter hormones the same. And then you have the vicious cycle where you are harboring excess estrogen because the liver cannot filter it. And so alcohol is a must that needs to be removed from the diet if you are wanting to shrink your ovarian cysts so that you can help yourselves with healthy reproductive system experiences and so that you can conceive the baby that you so desire. And lastly, a stressful lifestyle. How wonderful it is to be able to cope with the stresses in life because we are never going to have a stress free life. And so the gist is to be able to cope with that, to be able to also bring into the body certain adaptogens that are going to help you to adapt to life's shifts. That when you need to be on and energetic, your body will be able to respond, and that when the body needs to be calm, your body will be able to do so as well, and to go with the flows and ebbs and changes of life's shift, right? And so unhealthy body chemistry is truly what causes a lot of these issues with the development of these fluid-filled sacs that will bombard the ovaries if you are having these issues. So know that this can be resolved without surgery. To bring in the changes that I've already mentioned here, this is what I've done with my patient in close to 30 years successfully to help them achieve healthy reproductive systems and for those women that desire to conceive so that they can conceive the baby that they so wish for. Pray that all this information has helped all of you out. Find more, visit drjulissa.com. That's drjulissa.com. You'll also find there the information regarding my Epic Woman Health Program. And I'll talk to you all in the next video.